is wealth is one potent adage that captures the universal importance attached to a healthy mind in a healthy body. The very essence of our functional health system has propelled developed countries to integrate health sector planning and investment into their multi-sectoral system for accelerating the development of health in their society. Unfortunately, this international best practice remains a mirage in the healthcare delivery system of third world countries. While it is universally accepted that health is a noble and worthwhile investment in most third world countries exacting challenges of unhealthy lifestyles, unexpected outbreak of diseases, poverty and poor sanitary and environmental conditions have rendered existing healthcare services unreliable. In Nigeria, successive governments have invested time and money to tackle challenges in healthcare delivery, but rather unfortunately, corruption has made it near impossible to work, coupled with dilapidated infrastructure, tribal and religious disparities, lack of adequate and well-distributed funds, an ever-growing population, and inadequate manpower ratio of about 4 doctors per 10,000 patients have aligned to frustrate government's efforts.
Some of the issues leading to these problems include poor funding for the health sector, inadequate availability of facilities. But meanwhile, the doctor-patient ratio we have is dismal. Even the countries that we are traveling to, they have better doctor-patient ratios.
In most communities in Nigeria, primary health cares, they are shut down. Why? Because no nurses, no doctors, no health care givers. If government can help with a road so that the people in the community can access the primary health care.
As a medical doctor with many years of experience tucked under his belt, Senator Dr. Arthur Ifanyokowa, Governor of Delta State, has fought to change the narrative by upholding the mandate of SDG 3, which borders on healthcare for all. To achieve universal health coverage, the administration has strengthened primary health care, which is at the foundation of healthcare delivery, to ensure that every Deltan enjoys accessible, quality, and affordable healthcare delivery.
He has achieved everything. I call Governor Kowa the God-sent health of Delta. He's touched virtually every facet of the health sector. There's no area in the health sector, as far as I know, that Governor Kowa has not touched.
Delta State, we are doing our best because we have somebody who is a medical doctor, who is the governor of this state. He has so much passion because that is his profession, and he's doing a lot. That's why you see that a lot of improvement on the health sector in Delta State, and we are very happy with that.
It is worthy to note that Senator Okowa did not just begin his quest for better healthcare delivery as a governor. It will be recalled that his passion for reform in the health sector dates back to his days in the Senate, where he sponsored a bill to that effect.
Coming into the state, I felt that I needed to show an example, and within the first 2 weeks, we did send a bill to the House of Assembly, and it's been signed into law since 2016, and that law creates the Delta State Contributory Health Care Commission. And through that program now, we're trying to ensure that as many Deltans as possible access health care. But from the beginning, we insisted that the premium for all pregnant women and all children under 5 must be taken up by the state government, because these are the vulnerable group and we need to touch their lives. We need to change the narrative at that level.
The Delta State Primary Healthcare Development Agency, a parastatal of the Ministry of Health, is investing in health rather than budgeting for impending disease. Thus, it is delivering on its mandates to carry out key immunization, sensitization, disease surveillance and control through its existing 410 primary health care centers across the 3 senatorial districts.
The viral primary care system is what you actually need to ensure SDG 3 is achieved. His Excellency is a PAC man. He has always supported primary health care. And we want the health to be approached through primary care that is very accessible. Centers are in every community and the services are there.
With primary health care, you can get to the grassroots. And because of these free drugs that he brought for us, we always appreciate him because we meet the women in the grassroots and the children. The primary health care does a lot. It started with health education. You have to educate the people to know about what we are selling, the importance of the facilities.
To ensure universal health coverage without digging too deep into the finances of the masses, the Contributory Health Scheme was introduced to blot out out-of-pocket expenses and reduce hardship faced by the people. As at today, the scheme has recorded 661,632 persons and counting. A further breakdown shows that Equity Health Plan has 499,158, comprising 198,610 pregnant women, while 304,403 are children under 5 years old. Under the formal health plan, enrollees are 150,170, while the informal health plan has 8,108 enrollees. These numbers are encouraging and are evidence of the efficacy of the scheme.
His Excellency the Governor, Dr. Ato Ifanyokowa, has done very well in the health sector. We have over 650,000 enrollees that are accessing care under the Delta State Contributory Health Scheme. And a lot of them are pregnant women who access care free of charge across board in Delta State. And then under 5, and even as far as places like Polobobu, which is in the riverine area of Delta State, now they are accessing quality health care.
The contributing health scheme is really helping the community members in the sense that those pregnant women, they don't register in health facility before because of what? Finance. But now it's free. More grace to his elbow, Dr. Okowa.
The access to finance programs initiated by the Delta State Contributory Health Commission has revitalized several health facilities in the state. Funds are readily available from the Bank of Industry, which is used to recruit needed health personnel and purchase equipment. Some facilities in Aliokpo and Igbogidiabavo primary health care bear testimonies after the fact.
We are happy that before we go very far to take treatment, now is at our doorstep.
Ogo do well for our body. As we dey come here, we not dey pay $5.
As I dey here today now, I go do tests, do everything, all are free. Like the money when I for pay for the hospital now, I'll use and do another thing.
To improve access to primary health care following the trend of digital technologies, the Contributory Health Scheme is on course in developing its e-clinic software, which makes registration and data compilation easier for medical practitioners, as well as diagnosis and treatment of patients.
With this ICT platform, we can actually know the ailment that is happening at a certain area, and the Commission could take strategic measures to know this is what to do at this local government or at each areas to know best quality care to provide.
Deltans across the state are particularly grateful for the Contributory Health Scheme, as most families have felt the impact of its reach.
Go to all our facilities, like several primary healthcare centers, as well as secondary care facilities. You can go in there, get services for free, and that for us is a major win in the health sector.
Anti-malaria campaign is one area primary health care in Delta State has not toyed with. According to research, access to primary health care may reduce the morbidity and mortality ratio by as much as 66%. Therefore, the focal point of the Delta State Primary Healthcare Development Agency through the state's Malaria Elimination Program, SMEP, has been on developing intervention strategies to prevent and combat malaria. An important part of campaign has been the distribution of treated mosquito nets, with emphasis on its use through sleeping under it every night. This has gone side by side with free malaria treatment.
We do advocacy. We engage in civil society organization to go around the local government, organize drama to engage in a community dialogue. And as I speak now, the Delta State government has also approved another money which we want to use to go from house to house to enable people to hang their net and sleep under them. We had the free nets and free IPT. Every pregnant woman in Delta State that registered for antenatal clinic, the first day has a contact, it gets a free net.
The rollback malaria program, which Her Excellency that is championing, is spreading like a wildfire everywhere, and they've been protected by this mosquito net that they are sharing free of charge.
In addition to malaria program, measles and meningitis have also been identified as common ailments plaguing the people. To curb its spread, vaccines have been made available to combat any modicum of it anywhere in the state. These efforts are geared towards ensuring Deltans enjoy good health care.
We, the health center, are very, very grateful. We appreciate, because before we would not be really having this, but now that the parents, the mother, they are very happy that the immunization is on their doorstep. We want to say a big thank you to His Excellency, Dr. Kowa Ifeanyi. We say we appreciate his good work, that God should bless him for us.
Dovetailing these initiatives, routine immunization of infants and adults has become a tradition worthy of emulation in Delta State.
This our immunization, the injections that they are giving to us is very, very okay. I want to thank Governor Ifeanyi Okowa for taking care of us, and God will bless him.
Senator Ifeanyi Okowa is really trying for us, and he has done a lot of things for we, the mothers and pregnant women. Coming here for immunization is free.
Being in the vulnerable bracket, women and children have been the biggest beneficiaries as they enjoy free routine immunization. In a bid to reduce infant and maternal mortality, expectant women are catered for from antenatal to post-delivery.
The policies of our Excellency Dr. Ifeanyi Okowa is that is so enriching. It has provided free health services to under 5 children in the state. Antenatal care is free, delivery is free. That is going a long way to reduce the infant mortality and morbidity in the state.
As such, both pregnant women and new mothers have expressed gratitude to the state government for not only lifting financial burden off them, but also delivering tangible and quality services in the various health centers.
I feel so happy because I'm coming here with a joy in my heart that I come here, I don't spend any money to come and collect antenatal care.
Free antenatal care, free medical checkup, no payments, scan and everything, with drugs is all free. So we are grateful to you, Okowa.
Anytime we are here, there's always nurses available to attend to us. We didn't pay for anything. They gave us nets, they gave us drugs, they check us. So we are grateful.
The Ogareki Community Primary Health Facility recounts how supply of equipment were made by the state government to facilitate maternal and neonatal services.
Governor Okowa brought the facilities, and these facilities are really helping a lot. Secondly, for the immunizations, the vaccines, without them bringing it, we can't issue out vaccines. So the free vaccines they are giving is really helping. Parents are really responding, they are bringing their children for free treatment. When you have something free, you can easily grab it so when you are paying for it.
It is worthy of mention that primary health care is so fundamental that nothing can be taken for granted. For instance, in a chat with Smart Delta Media crew, Dr. Paul Yinkore explains that every step taken in community health is deliberate and carefully planned to take care of something as simple as nutrition. It is important people eat right as a preventive measure to forestall malnutrition. To this effect, Dame Edith Okowa has been decorated Nutrition Champion by UNICEF following her contribution and participation in several programs aimed at sensitizing the people of Delta on the importance of eating right, such as Annual Breastfeeding Week and Baby Show, teenage and adolescent nutrition seminars, iron and folate supplementation, as well as vitamin A supplementation.
Your efforts have touched many lives. Thank you for making a difference. God bless you.
We also provide deworming for children. In other words, provide anti-helminths to reduce parasite load in the children so that they can feed well. And parasites do not compete with the child for the healthy diet given to the child.
He also states that attention is paid to neglected tropical diseases, and the state has recorded impressive mileage in the control of poliovirus, guinea worm disease, and river blindness.
We work basically with primary care facilities at the local government level. They are all over the state, and they are created in such a way that people can readily go to them. They are accessible. We are saying let hands be on deck. Everybody should work hard. That this project that government has embarked on, everybody should give government a support to make sure we deliver.
Family planning is another area that the state's primary health has given priority attention to ensure that access to information on the best family planning options are made available. Sensitization and services are carried out in this direction throughout the state. Smart Delta Media had a chat with Dr. Okowo, a specialist in family planning. She shared deeper insights in what needs to be done.
For the past 3 years, a lot has been done in the family planning space. For instance, we have advocated because at a time we actually did not have partners for family planning. His Excellency has been given approvals for enhancement of family planning services in the state.
The counsel that was given to us about the family planning was really helpful to me, and it was free. And the 3 months one that I was taking, it was good to me because I feel relaxed. I'm no longer bothered about getting pregnant on time.
The benefits of partnership cannot be overstated, and Delta State Primary Healthcare Development Agency has been blessed with both global and indigenous partners like WHO, UNICEF, Caritas Nigeria, Association for Family Reproductive Health, Catholic Relief Services, and many more, who have worked to ensure that tangible services and quality inputs are delivered to the good people of Delta State.
They have helped address a lot of gaps. They have helped build capacity. They have helped support a lot of programs at the grassroots and help us monitor our services and get data to see the kind of progress. We are really happy with the outcomes.
The essence of partnering is evident to the people of Aniocha South local government area, as their chairman, Isaac Anwuzia, recounts how supplies have been brought to the primary health facilities in their domain by the World Health Organization, WHO.
Primary health care is very visible in the local governments. The state government has been of immense help to us, while at the same time, World Health Organization, they normally send drugs. Okay, without that, there would have been health problem. But you can see everywhere in the local government where you must have at least one primary health care in any town. So in my local government, the state government have done well. Okay, my people are okay.
In like manner, in Ogarefe community, Ethiopia West, the primary health center has been blessed with the dividends of partnership, as several inputs have been made by different bodies to enable them deliver health service seamlessly to their populace.
Like immunization, we have to preserve our vaccine. The vaccines are kept in the fridge, and because of the light problem, World Health Organization provided us with a solar fridge, and that's what we're using, preserving our vaccines. They help us with the kits for the malaria tests. The people of Ogarefe, the women, they want to appreciate Dr. Ifeanyi Okowa for making provision for them, and it is free of charge.
Knowing the importance of having authentic and quality medicaments, the Delta State government has continued to run its drug revolving fund to ensure the unlimited supply of essential drugs to health facilities across the state.
Delta State Drug Revolving Fund is the state organ to provide drugs for the healthcare centers, secondary and primary, in Delta State.
Delta State Drug Revolving Fund, the organization that sends drugs to all the hospitals in Delta State, Recently, His Excellency also wants this same gesture extended to all the primary healthcare. And the purpose of storing enough drug is that we don't want a situation when they want to come and collect drug, we need to tell them this drug is out of stock, that is out of stock. So the purpose is to make sure that everything is fully in place.
Pharmacist Eunice Obi, head of the Quality Control Lab, explains that beyond having a large store of medicaments for the Delta populace, key attention is paid to testing drugs. Although they have been approved by NAFDAC, a double check is done to ensure that having been transported from pharmaceutical companies, the drugs have not undergone any changes which will render them unsuitable for consumption.
The vision of the government is to ensure that our people, the citizens of Delta State, when they go to the hospitals, they get drugs that are safe, that are effective. And what we do here is to ensure, like a double show, that the same quality that is claimed on the label is what is the component of the drug before we now send them out to the hospitals. That way we are able to be sure that Deltans get not just quantity but quality health care.
From time to time we do a routine check in our hospitals, moving around the hospitals to pick some of our samples that are already in the hospitals to see if they are still stable to be distributed to patients.
On a visit to the primary health facility in Uwero Kingdom, Ughelli South, the Smart Delta team met a joyous community bubbling with songs and smiles, who told tales of free health care and medicaments.
I have to thank our amiable governor, His Excellency Dr. Ifeanyi Okowa, for providing this free medical treatment to Uguru community, whereby we don't need to go to the quack chemist to go and get drugs, whereby they give problems to our people. With these free drugs given to us here now, in fact, the life of our people is in a safer hand.
As these free deliveries come out, I was the first person to give birth safely in this community, in this asset as free. So I was so happy. Even this one that I have on my back is also a free delivery in this community too. And thank our governor, Ifeanyi Okowa, for being there for us. Without him, there is nothing we can do with this center.
Esther Igawe, the matron in charge of the primary health center, explains further the reason for the joy in the community.
The people of Ugwenu community, they are very happy because when they come to the facility, they don't pay for their drugs. We want to really appreciate the governor, Ifeanyi Okowa, for this gesture of free maternal and under 5.
You can see my baby now. My baby is looking fine because free drugs, free injection, everything is free. The governor, Ifeanyi Okowa, we need to thank him very well for taking care of our children.
The Okowa-led administration has changed the narrative and debunked the notion that healthcare delivery is impossible in difficult-to-reach coastal areas.
This, to me, is one of the most important things that I have been yearning for, and the listening governor in person of Okowa has done it.
This is something we don't expect. I'm happy in my time. I saw such a thing where you will pay hundreds of transport to Warri Sapele. It's here now.
Riverine areas in Delta State now spot some of the best primary health facilities with top-notch services and medical practitioners at their disposal to ensure that living in the riverine communities is not equated to a death sentence.
Now that this hospital has been established in this community, it will be of benefit to the women of this community and to the youth and to the elders of this community. It is a welcome idea and we appreciate the effort of the government.
Before you go general hospital or past break clinic, you go register before you go take drugs. Sometimes they go call like 30,000, 20,000 for you. Me, I know what they pass through. Everybody to give you free treatment, I appreciate. God go bless on our more in Jesus' name.
In summary, revolutionary marks have been made in the health sector. Still, the Delta State government refuses to relent on its efforts in delivering tangible healthcare services to her people, as this is a strong component of building a stronger Delta, as health, they say, is wealth.
to Delta State. Come and see the good things where Okowa they do you better. Run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta. Make the youth say them higher. Okowa. I see good roads everywhere in Delta. Make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.